Hi. So today we're going to go through all of the relevant news articles since the beginning of May that have any relevance to COVID, and in terms of COVID vaccine availability, COVID research funding, things of that nature. And here we're going to start off with Trump's executive order on May 5th that halts gain of function research. So, first off, what is gain of function research? Well, that's essentially manipulating a virus to see if it performs better in certain kind of ways when you tweak it this way, or if you tweak it that way, does it perform better in other kinds of ways? So this could be modifying the ACE2 receptor with different types of spike configurations to see if it's better at binding or worse at binding, and if it can attach to cells or not attach to cells, things of that nature. So that's essentially what it is. You're looking at things like transmissibility, the ability to infect cells, how strongly it binds to different receptors. That's the point of gain of function research, and this has sort of been turned into the boogeyman, where gain of function research is scary, and that's the cause of COVID origins in itself, when that's just not the case. This research is done in very controlled facilities for very specific purposes to sort of predict how pandemics might happen in the future. So, like with the bird flu pandemic, trying to predict how the virus could evolve to become a pandemic level event if bird flu does get to that point. So, this is what this type of research is good for, is trying to figure out, all right, if the virus evolves in this certain type of way, will that be beneficial to the virus and bad for us? And then if it does go that way, can we develop therapeutics to counter that, such as vaccines? Next, the FDA picked Vinay Prasad to be the head of the FDA Center for Biologics Evaluations and Research, which is essentially the top person for vaccines. And then, since it's good to know your enemies, Prasad has long criticized the FDA for granting emergency use authorization to the COVID-19 vaccine and their boosters, so the updated COVID vaccine formulations for the original COVID vaccines. Prasad is also backing the idea of the randomized controlled trials that would be mandated before vaccines could be updated, like the COVID vaccine, saying that it's absurd that young children can get this vaccine. And he has a long history of being a purveyor of misinformation about COVID vaccines in general. Next up, we have Stephen J. Hatfill, who consistently pushed hydroxychloroquine as a treatment for COVID, which is not a treatment for COVID at all. When they did studies on this, they found that if you had a hydroxychloroquine treatment with COVID infection, you actually had worse outcomes and were more likely to die than if you did not have hydroxychloroquine. Additionally, it is not just a malaria drug. It is primarily used for autoimmune conditions like lupus, so that's always something to emphasize. It is not a specific malaria drug. People actually use and need this medication. So when people get this medication unnecessarily for COVID infections, when it doesn't even work for that, it actually brings the availability down for people that actually need this to treat their ongoing chronic conditions. So how is Stephen connected? Well, Stephen was brought on as a special advisor in the director's office at the Administration for Strategic Preparedness and Response, which is an agency that prepares for disasters like pandemics and biological and chemical attacks, where this old out-of-touch man still maintains that hydroxychloroquine works for COVID despite the overwhelming evidence that it does not. Next, on May 6th, the Trump administration decided to terminate HICPAC, which is the Healthcare Infection Control Practices Advisory Committee that was put in place to set national standards for hand washing, mask wearing, and isolating sick patients that all, or at least most, of the US hospitals have to follow. And what this committee has been working on is to update and improve the guidance to include a whole host of different airborne diseases. And what this committee has been trying to do is update the guidance from 2007 to the present day to include a whole host of airborne and non-airborne pathogens. And now this likely won't be updated. So number one, we're still going to have antiquated guidance. We're not going to have any updates to mandate that hospitals have to use N95 masks as opposed to surgical masks. And then because this updated standard is not going to be put in place, hospitals are basically all going to be flying by the seat of their pants, doing their own different recommendations as opposed to having a unified recommendation across all programs. And then a couple days later, on May 9th, Rite Aid has filed for bankruptcy, and they've begun their first round of layoffs for their Chapter 11 bankruptcy, where they also put up all their brick and mortar operations for sale. So, why is this important? Why is this relevant to COVID? Well, COVID vaccinations are mostly given out at pharmacies. So, when you have Rite Aids going away, when those are going to get bought up by other corporations, when you have limited access, when you have stores closing, all these pharmacies closing, you're going to have less availability for vaccines to be put into arms, and people are going to have to go find other locales or drive even further or figure out something else to get their vaccine when they could have got it at their Rite Aid. And then for store closures, this is a list of all of the different locations. So here's a bunch in California, some in Connecticut, one in Massachusetts, some in New Hampshire, New Jersey, New York, Oregon, Pennsylvania, Virginia, and Washington. So all of these locations are places where those Rite Aids are going to be shut down permanently. We also have Walgreens closures. So again, this is going to limit vaccine access and availability because most people these days do get vaccinated at their pharmacies, so much so that a lot of in-office doctors' places don't carry a high quantity of COVID vaccines to vaccinate people because they expect a lot of this to be pushed off onto the pharmacy, a lot of that vaccine load. So again, this is a part of their plan to shutter 1,200 stores across the country over the next 3 years, with some 500 of those set for 2025. And then here are the locations of those stores that are going to be closing soon. So we have some in California, Colorado, Connecticut, Florida, Georgia, Indiana, Maryland, Massachusetts, New Jersey, New York, North Carolina, Pennsylvania, and Texas. And then in the previous update, we had talked about how NIOSH had been shuttered in all facilities except for like the budgetary areas of finance. So that a lot of the people that got fired had their termination letters rescinded and they had their job offers restored or their jobs restored. For how long we don't know, because there wasn't like a full restoration for a lot of these people. It was just like, well, we're going to keep you, but who knows for how long type of thing. And then in the same time period, Novavax got their BLA license approval. So in the big three, there is Pfizer, Moderna, and Novavax. Pfizer and Moderna, the mRNA vaccines, had already gotten full licensure for their vaccines through the FDA. The FDA awards these things. And then Novavax had still been under emergency use authorization, which is EUA. They had not gotten their full licensure yet, but they had submitted all of their data package. And then RFK was talking about, oh, we might not let you guys do this. We want to see a full randomized controlled trial with these updated versions of the COVID vaccine, saying that that's the gold standard of research. And if we're going to allow these updated COVID vaccine formulations to target this new strain, it's completely untested, yada, yada, yada. And that you have to have this randomized control trial before we would allow anyone to use this for healthy individuals. And then what they ended up doing in this approval, this licensure, is they only approved it for certain individuals through the age of 12 through 64 who have at least one underlying condition that puts them at high risk for severe outcomes from COVID-19, which really limits Novavax's market in the US because now you have to have at least one underlying condition to qualify for Novavax. Otherwise, if you're healthy and in this age range, then you can't get it. And then following those stipulations in the Novavax licensure, the FDA then announced their position on the COVID vaccine, saying they were going to limit it to high-risk groups and then those 65 and over, where until the May 20 announcement, getting a yearly COVID-19 vaccine was recommended for everyone aged 6 months and over, regardless of their health risk. And according to McRae and Prasad, the FDA is moving away from these universal recommendations, instead taking a risk-based approach, and they published an opinion piece in the New England Journal of Medicine. So this is that opinion piece. You can see at the very top it says sounding board. That's how you know it's an opinion piece. They published this paper saying who they think should get it, particularly this chart right here. And of note, within all of these conditions, there is pregnancy listed and recent pregnancy listed as a condition where you would require a COVID vaccination. So there's a couple problems here. The first is that the FDA doesn't make this decision, so them announcing their opinion on this doesn't have any impact or influence on who can actually get the COVID vaccine because the CDC is who makes that recommendation and signs off on it. So how does this happen? There's the Advisory Committee on Immunization Practices, the ACIP, which is set to meet June 25th, 2025 of this year to the 26th. And they're going to be going over the COVID vaccine recommendation, reviewing the data, and then making and voting on a recommendation for who is eligible to get the vaccine. So the FDA doesn't have any part in that, is the first thing. And the second thing is that we don't have a CDC director. So once the ACIP committee makes their recommendation, it goes to the CDC director. The CDC director then signs off on it. It goes to HHS and it's signed off again and then it's put into practice as a recommendation. So because there is no CDC director that's been confirmed into the position, we don't have that part of the process. So we need that before the end of June. And then more recently, RFK alongside Bhattacharya and Macri decided that they were going to make an announcement saying that the COVID vaccine was no longer recommended for healthy children and pregnant women. And then they emphasized actually not for all children, it wouldn't be recommended. So that's from 6 months to 18 years of age. Where, again, the problem here is that they can't do that. They don't have that authority in that sense because the ACIP again is meeting in the end of June to make the recommendation, which will go to the CDC director, who will then be signing off on that, and then it just goes for a formality signature with the HHS, which would be with RFK. So this is again them just kind of telegraphing, this is what we want, this is what we want, this is what we want, but we'll see that like they probably can't do it. And then following that bizarre news announcements where they tried to short circuit the process on how to actually get recommendations circulated, RFK is now threatening to bar government scientists from publishing in leading medical journals like The Lancet or JAMA. And then during one of these interviews where he was being asked about it, he was saying that, oh, we're going to open our own journal that is run by the HHS and we're going to publish in that. But that means that if that were to happen, they would just be able to put their thumb on the scale and only allow information through their journal that they approve of, that they accept of. And that would be a way to siphon and control the flow of information, saying we are the accredited source, these are our studies, this is the only acceptable, like the highest level, when they can literally just either manipulate the data or pretend like, oh, this goes against what my beliefs are, so I'm just going to not let that paper be published. And then continuing the Trump administration's attack on vaccines and vaccine availability and just the vaccine potential for the US. The US canceled more than $700 million of funding for the Moderna bird flu vaccines. So this $700 million in funding was a contract that had been awarded to Moderna for the late stage development of its bird flu vaccines for humans, where they were intended to do two things. One was develop a pre-pandemic mRNA-based vaccine against the H5N1 avian influenza that could be spilling over from birds. It's been documented in other mammals, but it hasn't quite yet been productive in humans yet. It has done a few spillover cases into people, but that hasn't spread widespread amongst people yet, so far as we are aware. So they were developing a pre-pandemic mRNA-based vaccine for that event. And then additionally, they are supposed to support the expansion of clinical studies for up to 5 additional subtypes of pandemic-generating influenza. So these are different variants of the flu that could eventually become a pandemic in the future. So they were supposed to be looking into that as well, and that was canceled. And then, like I mentioned before, the FDA can't really do that. They can't just unilaterally announce that they're going to be changing the vaccine recommendations. The CDC really has to be in charge of that and lead that, and they don't really have a CDC director that's confirmed yet, so they can't really do that. So they're already backpedaling, where the CDC is still recommending childhood COVID vaccines despite the RFK announcement. But there was an update in the new guidance where it says that parents who want to vaccinate a child for the coronavirus may receive COVID-19 vaccination informed by the clinical judgment of a healthcare provider and personal preference and circumstances. So this is saying that anyone that wants a vaccine may get it. And then this recommendation is specific to children. We don't really know about everyone else right now. But the problem here is that this language saying may receive the COVID vaccination with the clinical judgment of a healthcare provider. If we go to the actual website, we can look at that ourselves. So if you go on the child immunization schedule notes and we scroll down right here, it now says shared clinical decision making, ages 6 months to 17 years who are not moderately or severely immunocompromised. So these are quote unquote healthy people. So this shared clinical decision making. So that's the language I'm worried about because one, does that mean that people are going to need a prescription from their doctor? So do you have to make a doctor's appointment and get a prescription for the vaccine and then be able to get the vaccine for children? That's my first concern with this language, which is going to put up all these artificial barriers because it's going to make all these extra steps going to set up the appointment with the healthcare provider, getting the healthcare providers buy-in to give you the actual prescription, quote unquote, for the vaccine, and then going to get the vaccine, filling that quote unquote prescription. That's one way I see this going. The other part that has me concerned is this phrase down here with the informed by the clinical judgment of a healthcare provider and personal preference and circumstance. So this option for may get it um, makes it an actual option. And if it's a choice and not something that people should get, then insurance companies are going to have a choice to cover it and they're going to choose to not cover it. So then you're going to be paying a higher out of pocket cost for these vaccines to get your child vaccinated. And that's sort of my worry right now with how this is currently phrased. But again, we're going to have to see what happens at the end of June with the ACIP recommendation. June 9th is when the public comment period opens for the um, ACIP meeting. So show up, say we need vaccine access for all, that this is not a transparent process. The FDA can't unilaterally make these changes. The CDC needs to stand up and go for science based recommendations, and these are what those are.